A procedure that has come into the forefront recently has been what's known as vaginal rejuvenation. Even though we're talking about a specific area, the surgery encompasses several areas of the groin, and I wanted to discuss them a little bit more fully for people who might be interested. Obviously, with the different styles that have come into existence, this area has become a little bit more important. The vaginal rejuvenation, for the most part, involves the reduction of the labia minora, since as time goes on, the labia minora can become ptotic, droopy, and get in the way of normal function. Not only that, it can also cause infections of the vagina and even of the urinary tract infection. So there are a number of reasons why the reduction of the ptotic, droopy labia may be of importance. Along with that is also reduction of the clitoral hood, which in some cases is also slightly droopy and can cause problems in that regard. The labia minora, which is the bigger part, becomes a little bit more droopy and loses some of its fullness in terms of the loss of fat in that area, and fullness is sometimes asked by people. Along with that, obviously, there are the social implications, clothing and so forth, that does hinder some people and make them feel a little bit more aware. So this operation, it really works well for all those different reasons. I wanted to show you exactly what some of these things may involve. For instance, when we're talking about the labia minora, we're talking about this ptotic, droopy area that can get in the way of function and all the other things that I just mentioned. Along with that, you can have a clitoral hood that drops and gets sometimes in the way. The labia majora tends to lose some of its fullness in its youth and becomes a little bit flat. That bothers people to a large degree. So the surgery involves, as I mentioned, at least one of those three areas. The most popular area is obviously the area of the labia minora, which is shown here. And the operation that I like to perform is a pie reduction of the labia minora so that you actually bring it in. The scar that you have runs directly in. What I do is when I wedge out a portion of that labia minora, I tend to direct it towards the urethra so it doesn't get in the way of any function. Also leaves you with a small little scar rather than a large vertical scar. In the old days, a lot of people would reduce this by cutting it as if you were clipping the ears of a dog. That's not a very good procedure. One, aesthetically doesn't look very good, and two, you have a large scar that can be painful during normal activity. So this is the best way to do it. The labial hood is reduced by removing a portion of it and lifting it up so that the actual clitoris is not as hidden. Labia majora, as I said, is usually doesn't need reduction. What it needs is filling it in a little bit, and fat grafting to this area gives you a more youthful appearance. So overall, what you have is a reduction in the size of the labia minora and a little bit of fullness and reduction in the clitoral hood, giving you a more youthful appearance. Not only appearance, but as I said, it helps in terms of function. Many people have mentioned that their urinary tract infections have decreased, venereal problems have decreased as well, not to mention problems with irritation, rash, and also pain. So it's a great procedure. Procedure is done on an outpatient basis. You come in, you go home the same day. As a matter of fact, the day of the surgery is actually the easiest for the person. It's the post-op care. You have to be very careful in terms of sitting, activity, hygiene is critical, but everyone has ever gone through it has been glad that they had this procedure.